Today I'm going to be discussing the use of the spider arm surgical limb positioner for use in free flap surgery. We will start by discussing the setup for the spider arm limb positioner for use during the scapular tib free flap from the anterior approach. There are two ways to suspend the surgical arm, either with the spider arm base mounted on the ipsilateral or the contralateral side of the bed. By mounting the spider arm on the contralateral side of the bed, the base is not in the way of the scapular tib harvest. However, mounting on the ipsilateral side of the bed allows the arm to be completely lowered out of the surgical field when not in use, optimizing maneuverability for two-surgeon approach. This may be especially important when the ablative team needs to be operating on the same side as the flap harvest. Here you see the spider arm device mounted on the bed at approximately the hip position, oriented with the arm to the head. The spider arm setup begins after the patient is completely prepped and draped. It is very important to have adequate exposure of the surgical field, so we recommend fully prepping up to the midclavicular line anteriorly, the bottom of the rib cage inferiorly, and posterior exposure is dictated by the need for a skin and/or muscle paddle. After the patient is completely prepped and draped, a non-sterile assistant will position the spider arm at the level of the shoulder, and the included sterile plastic sleeve is then slid over the exposed arm. The elastic blue portion will fit snugly around the top attachment. There's an insert spot for the connector, which needs to be free from the plastic wrap, otherwise the connector will not fit snugly. For this orientation, we're using the straight connector. There is an angled connector as well, but here we are using the straight connector. Once it snaps in, there's a circular lock that slides up to secure the connector in place. For this orientation, we'll be using the shoulder kit. This is a silver straight bar and the associated blue kit. After you open it up, you'll notice a black pocket on the back of the soft sling. Put the straight edge of the silver tenon arm in the black pocket, and then fold the associated blue tab over top of the handlebar. Then taking the blue styrofoam sleeve and putting over top of the handlebar, this will protect the hand. You then position the hand in a neutral position with the bar positioned laterally to the arm. An assistant is helpful to hold this position firmly while you attach the sleeve. First you have the sleeve Velcro, and then you have the two circular straps. It's important that this sleeve is secured snugly, however, you do want to be careful of not over tightening it, as you can cause pressure injury if it is too tight. Next, there is a long strap that goes over top of the hand. You want to make sure that, again, the hand is in a comfortable neutral position, gripping the handlebar. With this in place, the entire assembly is then wrapped in Coban. Careful to ensure that the fingers do not move while you're wrapping the Coban, as this can cause significant prax injury during the case. It's important that the Coban goes across the entire arm and past the edge of the sleeve to prevent moving. By stepping on the hydraulic pedal, you're able to move the retractable arm into desired position, and then letting go of the pedal, it holds it in that desired position. We verify that you have adequate movement for the surgical field. It's also very important that the thumb of the arm is pointed towards the head to prevent any injury to the brachial plexus. You can also use the spider arm on the contralateral side of the body. Here you set up the base in a vertical position, again approximately at the hip. Again, after prepping and draping, you slide the sleeve over top of the retractable arm. Position the elastic over top of the connector to make sure that it does not interfere with the connector attachment. On this side, we will be using an angled attachment. And it should snap in, and then the circular lock slides forward. On this side, Because we're using the handlebar, it's the black handlebar that goes through first, and then you slide it into the black pouch to secure it in place. Again, you bring this to the patient. Using this orientation, the styrofoam goes on one side, but it doesn't cover the entire area. So we wrap a soft roll over the portion of the metal that is still exposed to prevent injury to the hand. In a very similar fashion, we then do the layered Velcro to secure it in place, keeping it snug but not too tight. And putting the strap over top of the hand to keep it from sliding down. Again, with the assistant holding it in place, the Coban goes on top to hold the entire attachment in place and prevent shifting during surgery. Here again, the pedal is pressed to allow release of the hydraulic arm. It's snapped into place, and then the blue ring slides down to lock it in place. Moving it over the head, you get to the proper surgical position. You can change the orientation of the hand by releasing the black handle and turning the thumb again towards the head. It can be lowered out of the surgical field until it's needed. You can also use the spider arm for fibular free flap. This is positioned on the bed rail on the contralateral side to the surgical site at approximately the knee in a vertical position. Again, the plastic sleeve is positioned over top of the retractable arm. All of this is done after fully prepping and draping the field. Here again, we will use the angled connector, making sure that the blue sleeve does not interfere with its locking. And then once it is positioned in place, the blue ring underneath the drape slides forward to lock it in place. Here again, we're using the black angled hand hold. However, we're not using the blue Velcro sleeve. The styrofoam sleeve goes on top of the circular footrest. And because there's exposed metal here again, we use soft roll to protect the foot from pressure sores during surgery. Positioning of the brace is very important to allow for proper positioning of the leg during surgery, as well as to make sure that there's not strain injuries either on the knee or the ankle. You want the straight arm of the brace resting on the bed, and it's leaning slightly inferiorly so that the foot can comfortably rest inside the angle of the brace. You then use the Coban to secure it in place. It's important that you include the ankle in this wrap to maintain adequate stability. However, the lateral malleolus should be kept exposed for surgical landmarks. After it's secured in place, you can then reposition the leg as desired for surgical exposure. This is Dr. Charles Meyer for the Mass Eye and Ear Robotic Surgery team. Thank you for watching our video.